or later? Right now? Okay. Now I will demonstrate the Vexus for the IVC. You can just scan from anterior and then to get IVC and try to make sure that the lever is in the center. That will be much easier. If you have difficulty to scan IVC, then you can use transhepatic approach. Over here, as you can see, it will be nicely to see the IVC, but also the other side, abdominal aorta. That will be quite easier to spot. You cannot see from anterior, but you can scan from the left side. For the rest part, hepatic, portal, and the renal vein, it will be easier to scan on flank side. Let's take a look at the central part as an example. Why I would not choose for this location, because right here, if you want to scan for the IVC, you have to tilt and try to make sure that the IVC is toward you. As you can see, right here, the pulse wave Doppler right here. This is how we see. We still can see, right, A, S, V, and D. Right here, the point. Okay? Right here, we can see a bigger S and D, and this is A, right? But if you got the ECG tracing, that will be easier to spot, all right? And then for the portal, as you can see, we have a right portal vein and umbilical portion right over here. If I put the sampling box right over here, let's take a look. We still can see the variation, but not above because of the direction of the sampling box and the flow direction. So I think it will be easier if you change to this direction or even the coronary view. Right here, I do some modification. I'm not just scanning longitudinal way. I also do some oblique rotation. Like here, make sure that the hepatic vein will be easy to spot in this direction. Right here, we are not asking our model to hold the breath. It's normal situation you will see. See the variation of the breath and everything. But you can still see S, D in this pattern, right? How about the intercostal space? If we scan from side of the flank, let's take a look at the effect. Scan from side, that'll be easier compared to anterior approach, right? Right here, we can put the sampling box right here. Right now, our model is not holding the breath. You can still see the nice view of this, right? Sometimes it's because of the sampling box deviated because of breathing effect. Right here, you can see AS and T, right? In this way, nicely view, the normal pattern, right? Then we go to the next target, tilt your transducer, and then you will find the portal, right? Portal vein is also bigger compared to left umbilical portion. And in this direction, the vessel is coming to your transducer, make the sampling much easier to spot. In this view, you can see nicely the portal vessels, right? The variation is so small. If you ask the patient to hold the breath, the view is even better. But I think in daily practice, we will not ask the patient to hold the breath all the time. So the best way is to find the beautiful view for us to spot. And for the kidney, again, the same side. Maybe you have to put your transducer to more posteriorly, then it will not block by the rib cage. Then turn on the color Doppler. Sometimes you need to increase again to make sure that the vascular signal is quite strong, and then we just apply the sampling box right over here, and right here you can see the arterial, and then sometimes you need to tilt a little bit because the bracing will move the vessel away. Right now you can see below the baseline, that's the venous flow, right? When you spot that, that's continuous without the phasic change, right? If possible, then we turn on the color, and hold the breath. Okay, now we ask our model to hold the breath and to sampling here. Sorry, you can breathe again. Hold the breath. So that's why this view is sometimes more challenging. Right here, we can sampling both renal artery and the vein, right? Venous flow will be continuous, and the arterial flow will be the low resistance one. All right, that's the demonstration for the Vexus. So I think the best way is from side, and then you will sampling the hepatic vein, right portal vein, and even the intrarenal vein as well. Use this side. That will be easier. If the patient's got problem on the right side, then you can sample the kidney on the other side. But I think choose one side that will be much easier compared to anterior part. All right? Because for the anterior part, I think even myself still have the problem to sampling the good view. Hold the breath. Sorry, you can breathe. Hold the breath. See, even here, we're sampling right here, very beautiful, and hold the breath. See, you still see positive, negative, right? It's because of the sampling is not so good. Okay, hold it, you can breathe. And then we goes to the hepatic vein. Maybe in this direction. Okay, hold the breath. You see? Nicely sampling right over here. You see, compared to the right intercostal, I think the right intercostal would be much better than subcostal view to sampling this. Because right here we encounter many factors of the breathing and the bowel gas. So pick up the right intercostal. The bigger view of the liver parenchyma can provide a better view to sampling for the hepatic vein waveform and the portal vein waveforms. All right, that's my demonstration so far. All right, thank you. Change to the next one. Do you need? So the next. Too fast. Wait a minute. All right. Any questions?
Sometimes I try to do the Vexus in the emergency setting, but the emergency patient can hold their breath and they breathe so fast.
Yes. If the patient cannot hold the breath, you need to just take the spot, maybe for just one or two waveform only, because the vessel will move it, right? So in that case, maybe you can increase the sweep speed, and then when the vessel's coming in and you have the time to take at least one waveform to do the analysis, because only the patients can hold the breath, you can get a beautiful view of consecutive waveform analysis in that situation. But if the patient's having dyspnea, the breathing rate is quite fast and cannot hold the breath, I would suggest to increase the sweep speed, and at least you put the sampling box right over here. The vessel is coming and back forth, at least you can sampling at least one waveform. As long as you can see the complete one waveform, you can do the analysis, right? You don't need to get a beautiful view like textbook. It's impossible in daily practice, especially if the patient cannot hold the breath. Any questions? If the patient is under positive ventilation, if possible, paralysis the patient, that would be much easier to do that, right? Completely rely on positive ventilation. But if the patients put on the positive ventilation and still have his own breathing, I think that positive? Yes, the same as spontaneous breathing, right? But if the patient is on positive ventilation and you can give the paralysis medications, and in that case, I think that will be easier to analyze the rest of the things, right?
Does it mean in positive pressure setting repeat like this.
Yes, the same. Yes. Because the passive ventilation, the great impact is on the transthoracic part. But right now we are analyze the distal part of the gut and the gut, liver, and renal flow, right? It's a reflection of the right atrium pressure. Actually, we use that to evaluate the patient's right atrium pressure. If have the invasive parameters like Swan-Ganz, the others, if you got direct information of the right atrium pressure, actually maybe you don't need to do the Vexus, right? It's a non-invasive evaluation of an organ to find the proximal part, because right now we don't have an accurate non-invasive way to evaluate right atrium pressure. If you have invasive, the monitoring already can get the right atrium pressure correctly, then you don't need to measure the end organ, because all we are doing is reflect to the right atrium pressure elevation. That means the patient is at risk for venous congestion, right? All these patterns may reflect to the RIP more than 15, right? No?
Any question? Any question?
If no more, then we move to the next live demo.
Okay, thank you. Thank you so much.
Thank you.
ครับ
เดี๋ยวขออนุญาตติดไมค์ครับอาจารย์
ครับผม ครับผม ได้ยินไหมฮะ ก็อย่างที่บอกไปเมื่อใช่ไหมต้องถือ
อันนี้เข้ากล้องหน่อยใช่ไหม
ครับผม
มีคนถือให้อาจารย์
โอเค ครับผม ก็อย่างที่